with ArborThotics.
Take it away, Don.
Hey, my name is Don Paris, founder and CEO of ArborThotics, and we're trying to connect, or we are planning to connect healthcare providers with 3D printing to reduce cost. So, I'm going to talk about a problem today that affects a lot of people. 1 in 15 children, 6.4%, have moderate to severe positional plagiocephaly. In the US alone, that's 250,000 kids, and 35,000 that have a very severe case, which is going to lead to some sort of developmental issues. So positional plagiocephaly is basically, or commonly referred to as flat head syndrome, and it's misshapen head or abnormally shaped. It's congenital and affects a lot of people today. But they treat these with these little baby helmets, cranial remolding orthoses. So these are prescribed by occupational therapists or orthotists, and they're typically prescribed at 3 to 6 months of age. And these are designed to guide the proper growth in the child's head, and they're quite effective. The problem is that there's only about 20,000 of them prescribed today. And with 35,000 kids with a severe case of this, there's at least 15,000, even if those helmets are going to the most severe cases, there's 15,000 who are not seeing treatment today. And we wanted to figure out why. Well, it turns out that it's a very complicated manufacturing process. So when we started this project, when we started this journey through TechArb, we thought what we had was a decent product idea, and they preached right away customer discovery is important. So we started talking to people. One person we talked to that was really helpful for us was the clinical director of orthotics and prosthetics at Seattle's Children's, and she told us for a fixed reimbursement of $900, which is supposed to cover the entire treatment, which is 6 months of follow-up appointments, the initial measurement, also procuring the helmet, that the helmets cost them $800. So almost the entire treatment is at a loss. This is a huge problem today. There's a lot of other reasons why we believe that there's not as many as there are. There's a bit of a stigma to the parents. They don't want their child, all their pictures at a young age, to have a helmet on their kids. The orthotists are trying to prescribe as many as they can, but it's tough. If they're taking a loss, you can only stay in business so long. And then there's the manufacturers who, it turns out, it's not the easiest thing to manufacture. So each of these devices is custom made to the patient's head, patient's anatomy, and the manufacturing process does not scale well. So we dug a little deeper. Turns out that the cranial remolding orthosis is the only FDA-regulated device in all of orthotics. There's other prosthetics with microchips in them that are regulated, but most orthotists do the manufacturing themselves. And these helmets, they have to outsource their manufacturing, and that adds cost. In addition to that, the manufacturing process, again, is very manual. So today, there's about a 5 to 10 day turnaround time for these devices, and these yellow steps are kind of the manual manufacturing pieces here. Basically, they take scans from the clinics and carve out a foam model of the child's head. Then they wrap that in heat-treated plastic, wrap that in heat-treated foam, bake it in a furnace, pull it out, and trim away to get the final helmet shape. On average, it's about 5 to 10 day turnaround time and about $500 per device. So we at ArborThotics are connecting healthcare providers with 3D printing through the cloud. And in doing so, we can bring together all the benefits of the cloud. We can automate the process as much as we can. We can make sure that it's secure and reliable. And there's really a lot of benefits there. We're taking a manual process and we're making it data-driven. And in doing so, we can reduce the cost. So by using 3D printing, we can offer same-day or next-day turnaround time and reduce the clinic-facing cost by 50%, which is truly tremendous. Here's an example of an early prototype we had. This helmet was generated algorithmically. The model for this was algorithmically generated, provided by scans from U of M Orthotics Prosthetics Center, and proof of concept right here that we can take scans and print a helmet. You may be wondering how big this market is. Well, for the baby helmets, at $250 a pop, it's about a $5 million market, but that's with the 20,000 today. It should be more like 100,000 helmets and about a $25 million market. But the broader custom orthotics and prosthetics is about a $1.25 billion market, so there's a lot more that we can grow to once we master the baby helmet production. As far as competitors go, there's kind of two sides of it. We've got the existing manufacturers who are FDA compliant and already producing these things. And then there's kind of software as a service 3D printing providers who are not FDA compliant, not manufacturing these. They're just providing the software. Whereas we are bringing both sides of it together. We're operating as a manufacturer who provides a software interface, and in doing so, we can cut across the cost of board. We plan on launching a pilot in the fall, and to get there, we'll be putting together an MVP so we can start iterating on this this summer. And once we have that pilot together, we can start to implement our quality validation, and we're actually working on the quality management system right now. Plan to do our regulatory filings towards the end of this year so that we can provide this cost-saving benefits to clinics at the beginning of next year. But there's a broader picture here. So we're starting with something we know we can print today and something that we know works and that we know there's a market for. But in doing so, by making this a data-driven process, we can improve the user interfaces, improve how long it takes to prescribe these things, and hopefully cut cost in as many places as we can. We can also plan on printing other things from here, other orthotic devices, other basically any sort of custom manufactured devices. There's a high overhead there. And by using 3D printing, we can reduce that cost. Our team, so I have years of experience in product development, automated web systems. Brett here has a degree in business, focused on logistics, and also in computer science, where he has a computer security certification. My consultant, Eric, has years of experience in public policy, doing insurance regulation, currently planning on working for, or will be working for, a insurance big data company, so he really knows the ins and outs of that healthcare system. Ben here, great guy. He founded a national nonprofit, Blueprints for Pangea, which takes excess medical supplies from hospitals and ships them to the developing world. And so far, they've shipped millions of dollars. I think one of the best accomplishments he's had so far was recommending that we apply to TechArb. Last but not least, we've got Alex Going, who owns and operates a ISO-compliant manufacturing facility in Grand Rapids, and he's helping us automate our quality management system in exchange for helping automate parts of his. We have a budget planned for this of about $50,000, and I think that we can do this. So we've hired some software engineers to help us get to this pilot, and the quality management, the FDA process is the most expensive part, but in partnering with someone who's experienced and has done this before, I think we can cut down the cost there a lot. The biggest question right now is the 3D printing materials and the process there, which we're actively iterating on and improving that right now. And with that, I want to give a huge shout out to everyone who helped us. TechArb provided the printer that we could prototype with. Michigan Medicine, U of M Orthotics Prosthetics Center, we were really close with. And really, we just tried to leverage as many resources on campus, and it was tremendously valuable for us. It was huge. It was awesome. And yeah, thanks.